Now, this discussion will give us an opportunity to delve a little deeper into some of the ways we can address coloniality in global health education. And without further ado, let me begin by asking, what do you think, you panelists, what do you think educational institutions in the global north can do to decolonize global health education without falling into the role of the colonizers once more? Now, Mariam, would you like to start us off?
Sure. So I think perhaps the first thing that we have to recognize is that the current structure is such that institutions in the global north are in the role of the colonizer. And so I would say the question that we have to ask is, how can we start to shift that power? How can we start to change our practices? And I think a lot of the things that I mentioned and Desmond mentioned, we have to face the fact that we hold disproportionate power and influence, right? We have to, we have to go beyond the performative acknowledgement that the power and influence that we hold is not necessarily deserved, and that it's not necessarily in the right place. So how do we start to shift that? And that's going to be very different depending on what your sphere of influence is, right? So if you are, say, the dean of a school of public health, you certainly have influence in certain matters that somebody who is an instructor in the school would not have. And when Desmond described, first of all, the financial barriers to, as somebody who is coming from a country that is, where global health is practiced, right? To have these financial barriers to participating in the program and to be so underrepresented, I think we have to fix that, right? As instructors, for example, we can, like I said, we can change the way that we teach. We can change the content of what we teach. We can change who participates in our teaching, who participates in our learning, and kind of break down some of those barriers. I think ultimately, and I really appreciate the point that Cristian made, is at the end of the day, right now, decolonizing is really a conversation for high-income countries and institutions, right? But a true decolonization would have to come from the global south, right? It's the point where global south countries are collaborating with each other. It's the point where public health education and research and the ideas are coming from the global south rather than high-income countries. That, I think that's we're pretty far away from that goal. But I think we can, the way that we would have to imagine global health coming from the south is very different, and it's a completely different global health than what we see right now.
Yeah, absolutely. I mean, it really is a systems change in that context. And Cristian, would you like to add a point?
Yeah, I was participating in a similar conversation a couple of weeks ago about Latin American social medicine, which is kind of a homegrown approach to addressing the social determinations of health. And something that what I see at the moment is a lot of kind of groups, spontaneous groups, not institutional groups, raising these issues. So like student groups, for example. Me, myself, I'm part of different groups, including one with Desmond where we are writing something. So it's more like meeting people that have similar worldview and trying to do stuff. And this is at the outside of institutions, because I think what we are kind of the diagnosis here is that there is a problem with the current institutional kind of architecture. So we need to start doing stuff from the outside, and doing stuff from the outside is not easy. It's because you don't have the funding, it's lower, you don't have all the connections. But I can see that we do have the intention and the motivation and the willingness to kind of to go beyond our current roles, because we know that this challenge will not be solved through the institutional mechanism, through the inertia. No, and so what else do we have? We have kind of human connection, human interaction, groups created, but we also need to learn how to use institutions, not to deny any connection with them, but to try to create this kind of a flexibility, you know, to take advantage of opportunities. And I'm saying this also to students. Students currently doing masters or postgraduate programs in the global north. I did myself. I studied a master and a PhD in London at the LSE. So the lessons that I learned is that you have to use the space that you're lucky to have, in a way. Either if you are in your own country or if you are in an international institution, there's stuff that you can do to kind of create these connections, create these groups, create these initiatives. Just to give a brief example, and with this I finish. At the moment, with a friend, we are doing something that is very kind of without any institutional support. We want to collect, we want to talk with people that is in between the South and the North, in the sense that they are project leaders, local project leaders that are receiving funding and administrating projects from the North. And we want to understand their views on what does equity, justice, and reciprocity means in the context of real projects. So we launch, and I'm going to put it in the, because it's a bit of publicity, we launch a call for those agents to participate in this. And this, we don't have any funding. We just want to know, because we think that this is the kind of stuff that will change things. If you learn stories and experiences from people on the ground, as Desmond was saying, you know, and as Seya Bembola is constantly insisting, is how to give space for the people on the ground. You know, how do their experiences make a difference? And we need to create kind of the challenge, the channels for that to happen. So those are some possibilities.
And if I can just add something there. Yeah, I mean, to the point of Seya Bembola emphasizing the local gaze, you know, I think that he's very much on point. You know, he had an excellent article out this past week on the use of knowledge in global health, right? And he's pointing to the fact that there's significant gaps, even troubling gaps in global health knowledge, in the way we perceive global health knowledge, in the way we use global health knowledge, and who uses global health knowledge. And so, but the other point that I would make to youth students studying global health in high-income countries is, well, how do you find ways to hold your institutions accountable? That's a question that you must think about. As an example, you know, when I was studying my master's programs, I tried to advocate for scholarships for students from low and middle income countries. And I remember one of our directors at the time telling me that, I mean, she was very frank. She said, well, you know, this program is kind of designed to get money for the university. There are students that are willing to pay. And so it's, you know, you're not going to get those scholarships, right? And so the university makes money because there is a demand for global health programs, and students from high income countries are willing to pay that. So that's almost to the exclusion of students from low and middle income countries. And so the question, and so that's why I think decolonizing global health education will be a challenge, because there are fundamental interests, the basic interests that different institutions have. And, you know, Mariam, you asked a question that I noted down. Well, it's a statement you made. You said, you know, we have to be willing to lose power and or privilege. I agree, but I think that's an ideal. That's the question is, nobody wants to lose power. Once you've tasted power, people are not going to just give it up, right? So how do you as students hold those in power at your institutions responsible to make sure that the equal opportunities for those from low and middle income countries? I guess maybe I'm not even giving a suggestion, but I'm just giving you a question for you all to reflect on. Find ways within your universities, engage with the leaderships, advocate, protest, whatever is needed to change these dynamics.
I'm not sure. Yeah. Were you done, Desmond? Yeah. Okay. I'll just maybe add, what you've already said, you've already articulated such important ideas, and maybe I'll just, provide a few examples. I think Cristian, talked about what we can do, as individuals working within the system, and I think as educators, like as faculty, and when we're teaching in the classroom, one thing that I think is really important is to offer perspectives and readings, from the global South, and consider creating joint courses between countries, and I think that those kinds of interactions and perspectives, and really really engaging, are going to help students grow, I think, in a really meaningful way. And again, I think that it was Mariam who mentioned, providing reciprocal experiences. Americans tend to, ship off their medical residents and, a month in Uganda, and, as part of their, training. And, I think that a lot can be learned, through those experiences, but make it reciprocal. So we all understand what it is to host for those experiences, and we all can have a sort of a shared equitable experience on both sides of that. And again, in thinking about maybe the more applied side, and thinking about when students go to conduct research in a different country, have explicit discussions about these issues, about power imbalances and authorship. And I feel like there's not enough of those really careful, thoughtful discussions around authorship and the power balance that kind of goes along, with those roles. So those are some suggestions.
Thank you all for your points. I agree that I agree with Desmond that student activism is primordial in holding our institutions accountable, and actually students can have a say. So that's really a huge tool we can use. But also, as you said, Ella, we as students really need to critically engage with the knowledge we are being taught, and be taught how to reflect, whether it be in the classroom or later on when we are conducting research, and engage also with academic publications a little more critically. Yeah, and I guess the next question links into that reflexivity, perhaps. So how do you think we could establish formal pathways to examine our own motives and recognize power dynamics in global health research? So that could be linked to publications, as say Asimbola has suggested in his Foreign Gaze article, or that could be in research overall. So how do you think we can invite reflexivity in global health research? And perhaps, Mariam, would you like to start us off again?
Sure, just to unmute myself. I think that's a really tough one. I think for the most part, I would say what's happening right now is that people who already have an awareness of these issues engage in this reflexivity in a self-motivated way, right? There is nothing really forcing you to do it. There's nothing, I'm not even sure that there's anything necessarily incentivizing you to do it, right? When we talk about the incentives within our institutions, which are, you know, academic recognition, for example, or funding, professional advancement, you could have a career that's very successful by, you know, most accepted measures, without ever engaging in that reflexivity. And it's the kind of thing that's actually difficult to enforce, if you will. And I think one thing that definitely needs to happen is a culture change. And the fact that there are more and more of these student groups, the fact that people are going to start integrating this into their courses means that there will come a time when there's a whole generation of people in the global health workforce who have that awareness, right? Who have been taught to engage in that reflexivity. And I think that's one of the things that has to happen. In terms of formal pathways, that's a lot harder, right? Because then you have to think about how do you make this required for all of the, you know, the resources and the rewards that are part of this whole enterprise. You know, the one idea that I have is, you know, something similar to how we have ethics review for research projects. Can we then, as part of that, when people are conducting projects that could be considered global health projects, whatever that means, require them to include some discussion of how are you addressing inequities and power imbalances and sustainability and local perspectives into this project?
I just want to add something that I'm thinking right now, and that it's related with parachuting or with kind of a travel. I think that somehow reflexivity is connected to moving from one place to the other. I think that moving is still good and it's still necessary. It has to change. How do we kind of administer that? How do we shape these movements to be more reciprocal? I think that there's a lot to do about that. But in my case, and I think that maybe some students at Karolinska at the moment that come from Latin America or Africa, or they will share the idea that it does help to have a view from the outside, even to better understand the issues that your own country confronts. It's good to have this view. It's good to talk with people from places that in your own country you really didn't have any opportunity to talk with, because it forces you to explain, and when you have to explain, then you need to learn, and you need to learn in a better way because you don't have the shared view or etc. So I think that in relation to reflexivity, the ability to know deeply what happens in other places, it's still relevant and should still be part of what we want about global health, but in a different administration, with kind of avoiding the asymmetry of who goes where and for what, for how long, etc., etc.
And as you're both speaking, you know, a checklist comes to mind. I don't know if it's a great idea, but you know, coming up with an institutional checklist, because you know, we can rely on the individual to be good-natured and to have that reflexivity and to say, well, you know, you have to bring in your collaborators from the beginning, from, you know, and make sure that you get their points of views and all of that. But, you know, there's also a benefit in having some kind of institutional checklist where, you know, your researchers can go through and and make sure that, okay, you know, this research project, you know, who was the primary person that came up with the idea, right? Who was involved in the ideation? Which communities the research going to be implemented? Have they been consulted? Have they provided input? Have they collaborated? You know, where is the funding coming from, right? Who disperses the funding? Who receives the funding, right? What do the locals get? All of these, I think there's probably some benefit in having a checklist. But even as I say that, I don't think that, like I mentioned, the problem is that people don't know the right thing to do. It's not necessarily a choice between right and wrong. It's often a choice between right and easy, or between right and fundus, right? In a sense that, you know, yes, we understand that we have to get, you know, work with our local teams, but they take so long, you know, and it's hard to get them. So let's just put the proposal together really quick. The deadline for the funding is approaching. Let's submit it. Once we have it, then we can take it. They'll be happy to have the funding, right? You know, the most important thing is the funding. So even as I say that, I realize that people understand, most people, you know, understand the need for buy-in, understand the need for sustainability. But there are those interests, those, you know, funding that drives us to choose the path that is easy versus the path that is right. And so there, you know, if you want to choose the path that is right, there are probably some sacrifices that you may need to make, or proper planning, right? To say that, well, this funding is due in 1 week. You know, unless I've developed a long-term partnership with someone on the ground and, you know, we could really pull it off, maybe this is not because it's not, the funding is not the only thing, right? We've seen, you know, projects and projects and projects and projects that are funded, but they fail to deliver the results, right? So it's better to go about it the right way and get sustainable impact than to go the easy way.
Yeah, great points. I mean, I absolutely agree that it's very important to go in a more holistic way than perhaps. There's also a risk that if you include like a similar section to an ethics review in publication, that people might copy and paste the same thing systematically. And to really invite reflexivity would take work. And so you do need the engagement of researchers as well. Unfortunately, I'm noticing that Ella has dropped out. I'm assuming it's because of a connection issue. Oh, wonderful. Fantastic. Great to have you back, Ella. Sorry, I think you're muted.
Okay, yeah, I was having a little trouble in muting myself. So, I think it was one of my cats in the basement that attacked our internet connection, so apologies.
No problem at all. Thanks for joining us. And now I'll move on to the questions from our audience, which were plentiful. Unfortunately, we won't have time to go through all of them, but I'm happy to send them to the speakers if that's something you would be interested. There's really a lot of very interesting reflections. And perhaps I will start with a question for Mariam. What are your recommendations or experiences for how the Global South scholars can be fairly recognized and compensated for contributions in cross-hemisphere teaching? So there is great potential for intellectual exploitation, and we see this through the phenomenon of token authorship.
Yeah, I'll say first, I really appreciate what Desmond mentioned about the little brother effect, right? That in this collaborative research, the collaborators who are in the Global South are seen as essentially technicians, right? They're collecting the data, but they're not really, you know, having the key intellectual input or leadership in a project. And I think one thing that's interesting is that we are sitting here for many of us in the global north, thinking about how to challenge our own power and privilege. And I think actually that in the global south as well, these structures of power and privilege can be invisible. I think a lot of people live their daily reality without necessarily realizing how much, some person in some country they may never even have heard of is influencing their life. And I think we actually have, we can work to also discuss these power imbalances, these hierarchies, the historical roots of them, their historical roots for people in the global south, have that conversation in the global south. And I'm hopeful that can also spur people in the global south to revolt, if you will, against these existing arrangements that are highly unequal. I mean, if you think about, decolonization in terms of like the actual end of administrative colonization, much of it was a movement of rebellion against the existing structures, right? It was people in the colonized country saying, no, we can govern ourselves. And I think we're going to have some of that movement from the global south saying, no, actually, I don't want to be just your technician. I don't want to participate in this project if you haven't included me from the south. Now, it's hard to do that when you're dependent on funding from these projects. And I think one big hurdle is the ability and the willingness of governments in many countries in the global south to actually fund these endeavors, right? I think when you have that funding power, it gives you so much more say in how things are done. So I think from the global south, we also have to work to push our governments to give us that power.
And I might actually, thank you very much for your point, Mariam, and I might actually jump onto another question from our audience, this time addressed to Cristian. This individual stated that they really liked your point on LMICs having limited sovereignty with regards to medical innovation and contribution, which is heavily intertwined with the colonial past. So how do we empower our local structures to challenge this notion, whilst economic bargaining power seems to be a weightier bargaining tool?
Well, that's a super challenging question. I think it's similar to what Mariam was trying to reply to, because of course, like health is important, but it's one sector in our countries, and I mean it's funded and it's designed by one sector, which is kind of the health sector, but of course it transcends this, and it's intersectorial, it's interdisciplinary, and when you move into how to mobilize the political system into making decisions, then you need to go quite beyond health, and it's hard, and at the same time it's interesting because in Latin America you have a history of populism, and governments and politicians, making this kind of proposal of sovereignty and independence, and they have in a lot of, lots of times it went quite wrong, or it was kind of a populist strategy to gain power and to gain support. So I don't know, I think it's delicate. I think that from the perspective of a teacher and a researcher based in the global south, my view is that at least you need to train practitioners that are aware of the limitations of our own sovereignty in relation to decisions about health, in relation to the technologies that we can or cannot develop. And we need to get rid of the kind of developmentalist view that it is just a question of time, or that we are in a certain level, and if we do things right, then in some 50 years we will be on the level of countries like, I don't know, the UK or Canada or the USA. We have a kind of a geopolitical integration that relies on this asymmetry, And also, again, in Latin America, you have these authors from the 70s and 60s talking about theories of dependence, you know, and the fact that regardless of the efforts that you can do locally, since the kind of the global composition of the world powers will put you in this position of dependence. It's not because of your own weakness. So I think that going back to the point of Mariam about history, you know, and learning history and situating public health and global health within a historical context, this is also something that should be part of the curricula, to understand the place that we have come to fulfill as when we are in certain places. But beyond that, I think it's a tricky question. It should involve much more voices than health.
Thank you, Cristian. And now I'd like to direct a question to Desmond. So a member of our audience states, being a Ugandan, I'm wondering what role will the LMIC citizens play in this decolonization process of global health? Because we are too used to waiting for solutions and fundings from the Western world. How can we start to locally raise resources and optimally use this to fund the different projects that directly affect our people? Could there be better approaches that other countries have used to encourage philanthropy that could be helpful in the LMICs? For example, in Africa, we have about 18 billionaires, and involving them in taking some responsibilities would be a big step for Africa to dictate what they want. What are your thoughts on this, Desmond?
Yeah, in addition to the 18 billionaires, we have millions of those in the diaspora, and that's kind of untapped. Lots of those in the diaspora are looking for ways to contribute back into the development of their countries. So, you know, working with, you know, those 18 billionaires and the millions of diaspora could be one way to go. Mariam, I'm going to come back to your point. Is we have to be willing to lose power and or privilege. I think that point just hits me. You know, it's either you lose power or you take power, right? You know, I think we in LMICs need to think about these power dynamics. You know, how do we position ourselves in a way where, like our, you know, the leaders of the colonial movement fought for the independence of our nations. You know, I think of people like Kwame Nkrumah, you know, Julius Nyerere of Tanzania, Nkrumah of Ghana. You know, these are people who organized themselves, right? They wrote passionately about African independence, even at a time when, you know, a lot of the colonial, you know, powers were very much against that, and they made claims like, you know, we're not ready for independence, we're not capable of managing our own affairs, right? But these people challenged those systems. Patrice Lumumba, right? Thomas Sankara. You know, these are African leaders who so we must find ways from the South to position ourselves in a place where we can take power that is rightfully ours. And that requires courage. You know, it's a deep issue, and you need to be courageous, because, you know, oftentimes when we talk about these power imbalances, you know, the discussion falls back down to, but, you know, there's fear of losing your funding, there's fear of losing your collaborations. There is that but, and that is a very big but, and that's something that you have to be willing to lose in order to effect fundamental change in such a deep-rooted system. So for you in Uganda, ask yourself the question, What are you willing to lose in order to change the system, right? You know, what are the things that make you afraid to speak up? You know, what is it that holds you back from speaking up when you get involved in an exploitative partnership, or you get involved in a partnership that you're not okay with? How can you write about these issues and get your voice out there? How do we organize ourselves in the South so that our voice is amplified? Because the more of us are speaking about these, the louder our voice, and the more we can challenge, and the more power we have, right? Again, a seminal in African history, there were seminal conferences organized by Kwame Nkrumah in Ghana, right? And in that conference, there were leaders all over the world, from all over Africa, who came and they discussed how to get Africa's independence. They then went back into their communities and they fought for independence. So these, again, are things that you individually have to think about, right? Fight the fear. The fear is the thing that holds us back. We're afraid of losing funding. We're afraid of losing collaborators. We're afraid that we need to fight, that we need to speak up.
Thank you for that, Desmond. I think we're coming close to time, but before we go, I'd like to ask Ella our last question for today. So a member of our audience asked, how do you guard against epistemic oppression and perpetuating global North academic research methods, frameworks, and ways of thinking? So what methods do you use for inviting non-discrimination? Their specific concern is about research imperialism, I assume.
Okay, thank you for unmuting me. That's a great question. I think that this question or this issue is related to how the audience, or what Che Abimbola would refer to as gaze, shapes the message in the publications that and the research that we publish. And the, how these, frameworks and methods are perpetuated by the accumulation of power in international English language journals. To build on what Mariam had said about shifting the power structures, that she gave the example of funding needed for grants and research, to shift the power structures into local regions. And I think that in this case, what is needed is a shift in the academic institutions' expectations around what will count for promotion, because that is a huge shaper of where we publish. We're all beholden to these standards as academics, and not all researchers are academics, but I think that what is needed is a shift and to mobilize around this issue of like a shift in the change of expectations for promotion to allow faculty to advance when they're able to publish in local journals. And when you're able to publish in local journals, a lot changes with that shift. You can you have a lot more freedom and more power. For non-discrimination, I guess I wasn't sure exactly what context the person was thinking of. I know we're sort of at time. I will say that in terms of props in our activities, we do train our peer reviewers to be respectful in our trainings, and we also read every review that comes through. We talk to our reviewers if something is submitted as well, wrong, of course, but also not respectful, and then we talk to our reviewers. We have a discussion if something like that occurs. So I'll stop there.
Thank you so much, Ella. That was a very good explanation. I mean, I understand it's a a question that's loaded with a lot of different layers as well. And that actually takes us to the end time. So I'd like to thank you all so very much on behalf of the whole DGH team. You've made this discussion incredibly interactive, and we've all learnt so much from you. I'd also like to thank Eileen, who did a wonderful introduction, and the rest of the DGH team. I will be communicating the audience questions to our panelists. And you may also find a recording of the Zoom session on YouTube in the next few days if you would like to listen back or share with your network. And we will send a reading list to all of our attendees. So thank you very much to everyone, and I hope you have a great rest of your day or your evening, wherever you are in the world.
Thank you.
Thank you.
Thank you, everyone.
Thanks, everyone. It was great.